My name is Victoria Gomez. I'm Assistant Professor of Medicine in the Division of Gastroenterology and Hepatology at the Mayo Clinic in Florida. I also have a significant interest in bariatric medicine and endoscopic therapies. Obesity is associated with significant health, social, and economic effects. These include social bias and discrimination, increased medical costs, and increased risk of many diseases, including death. We all know that achieving significant weight loss is difficult, and although many weight loss options exist, including dieting and pharmaceutical drugs and surgery, it can still be difficult. Diets can be successful in the short term, but fail for many reasons. Exercise also does not always lead to weight loss, and although a growing number of pharmaceutical options exist for weight loss, these only produce a modest effect. Surgery, while the most effective approach for long-term weight loss, is not desired by all people wanting to lose significant weight for many important reasons. Our team at the Mayo Clinic now offers endoscopic bariatric therapies, which are weight loss therapies through the use of endoscopy. Endoscopy is a minimally invasive approach in which a flexible plastic tube with a camera and a light are placed down someone's swallowing pipe, also called the esophagus, and into the stomach and intestine. Using endoscopy, one of these approved therapies that we now offer is the intragastric balloon. The intragastric balloon is placed temporarily in the stomach for 6 months, and it encourages portion control. For more than 20 years, the global medical community has been using these gastric balloons to help thousands of people lose weight. These balloons are now FDA approved and have been evaluated in numerous studies and have been shown to help people lose more weight when you compare it to just diet alone. The balloon takes up about 1/3 of the stomach, and in doing so, it helps you eat smaller meals and enables you to stick to your diet. On average, patients that had the balloon placed were able to lose 3 times the weight one would typically lose with just diet and exercise alone. And studies have shown that this weight loss can be maintained for a considerable period of time once the balloon is removed. Placement of the balloon is performed in our GI endoscopy center under sedation. We place the balloon in the stomach in a deflated state, and then we fill it with saline until it reaches the size of a grapefruit. The balloon is then deployed and sits in the stomach for up to 6 months. We then bring the patient back 6 months later to remove the balloon. And this also occurs in our GI endoscopy center using sedation. During this procedure, we puncture the balloon with a needle, we aspirate all the saline, and then we remove the deflated balloon through the mouth. This procedure also takes less than 30 minutes, and the majority of patients go home the same day. Evaluation for the intragastric balloon involves extensive and important counseling and education by your physician and multidisciplinary team. During your visits with each team member, weight loss expectations, the expected symptoms with the balloon, and the risks involved with placement of the balloon will be reviewed. You will follow up with our team during regularly scheduled meetings to review and sustain healthy habits that hopefully will allow you to keep the weight off. Additionally, as with other treatments, the intragastric balloon may not work for everyone, and this is an important point to make and one that would be discussed during your clinic visits. Achieving and sustaining weight loss with the intragastric balloon, or with any weight loss enhancement for that matter, can really only be accomplished with behavior modification through the support of your multidisciplinary team. To be considered for the balloon, you must have a BMI of 30 or greater, regardless of obesity-related diseases such as asthma, sleep apnea, arthritis, or diabetes. Most importantly, you must be motivated and ready to make that lifestyle change. Our Mayo Clinic Bariatric Center and Department of Gastroenterology are here for you and ready to help you take that next step toward a healthier lifestyle and successful weight loss.